So Richter's transformation is one of the most aggressive diseases that occurs in patients with CLL. Some patients have de novo Richters, other patients can have Richters that occurs after many lines of CLL therapy. In general, those patients with treated CLL that develop Richters have a much worse clinical outcome. And while some patients can be cured of their Richter's disease with chemoimmunotherapy, the majority of patients are going to relapse of their disease. And we know that overall survival for patients with Richter syndrome is very poor. There's always been one sort of historical therapy, allogeneic stem cell transplant, which offers a curative intent procedure, but that procedure only is effective if patients are in a really good remission going into it. And on top of that, it comes with a lot of toxicity in terms of non-relapse mortality. And the data that I'll show shows that about a quarter of patients will die, not because of the disease, but because of complications of allogeneic stem cell transplant. And so it's time to just move on. We have new exciting therapies with cell therapy, specifically CD19 CAR T-cells. We know from clinical trials that they're effective in diffuse large B-cell lymphoma. They're the second-line therapy and has a survival benefit. And we just have data now in a recent approval that they're effective in CLL. So it's only logical that this therapy would also be effective in Richter's transformation. There was a large retrospective review that actually demonstrated the efficacy that was recently published this year. But more so, it offers a single infusion treatment with a better safety profile. And so this should be the preferred therapy for patients that fail chemoimmunotherapy with Richter's transformation instead of allogeneic transplant. But like all therapies, CAR T won't work for everybody. And so allogeneic transplant now becomes an option for those patients who fail CAR T-cell therapy.